Hello, welcome to Posture Projects. I'm Dr. Willawanek here, River Valley Chiropractic. We had a patient in here earlier today, and she had was diagnosed with plantar fasciitis. She got some orthotics, and she had some other things for her shoe that she kind of put in, and it hasn't been helping, and she's still having heel pain. Well, the thing is that with plantar fasciitis, you want to realize with plantar fasciitis, it's a little bit different beast. Right here, if you look at this diagram, this is a netter. And you can kind of see the plantar fascia here. You can see this band of tissue all the way from the toes all the way down, inserting here at the heel. So this is your heel, these are your toes. And with plantar fasciitis, the pain usually is in here and and also at the attachment right there where the plantar fascia attaches to the heel. Also, with pointing your toe up, that also causes pain, or causes pain also in the plantar fascia. However, this particular patient, she had pain right here at the center of her heel. So when I pushed here, she wasn't having a whole lot of pain, but when I pushed there, that elicited the biggest complaint for her. And as you can see here, what's going on here? There's actually a pad. It's actually a fat pad here that helps to cushion the calcaneus, or your heel. So what she's got going on, as opposed to plantar fasciitis, what she's actually got going on is called heel pad syndrome or fat pad syndrome. Over the years, this fat pad has kind of worn down, and it's kind of like when she heel strikes while she walks, it's kind of a bone-on surface situation. It causes quite a bit of a sharp pain in there. So I'm going to show you a quick way to tape this particular area, so that way it creates a fat pad temporarily that you can use, and that way you can continue to walk and run, and you can use it for any athletic pursuit while it's taped up and without having that pain in the heel. So in just a moment here, I'll go ahead and show you how to tape that up. All right, I went ahead and took it off my shoe here. Here's my foot, and it's not a pretty foot, but it is a foot. Again, she was plantar fasciitis involves pain in through here, also right here where the plantar fascia inserts on the heel. Where she's having pain is right here, right in the dead center of her heel. Basically, this pad here of her heel has worn away, and it's kind of like just skin on bone right there. So I'm going to show you a way to tape. This is just regular old athletic tape. You can get this at Walmart, anywhere. Walgreens has athletic tape as well. I'm going to show you a way to tape this to create a pad here naturally without having to buy, heel cups or other orthotics or anything like that for your shoe. And that way, over time, by taping this on a regular basis, that heel pad will actually heal on its own. And over time, you'll have to tape less and less, and eventually it'll heal altogether, and then you won't have to rely on the taping. So the first step actually is to wrap the arch. So to wrap the arch, start here at an angle, just like that. It's not straight across, and I'm going to go, there's a bone right here, I'm going to go kind of behind that bone. And again, I'm going around, and this is my arch of my foot. There. Okay. Now, I'm going to take this here. This is my anchor. Start low, right there, and I'm going to try to create a cushion here. So what I'm doing, I'm going to tighten this really tight here. Again, anchor. It doesn't have to be pretty, because you guys are going to be putting your socks on and all that stuff. It doesn't have to be a pretty taping job. No one's going to see this. And again, you're not taping it to look pretty. You're taping it so that way you don't have any pain in the heel. Again, you're going around. As you can see, the second strip is a little bit higher than the first strip. The third strip, again, is a little bit higher than the second strip. And again, you're locking that heel in there. Okay? Grab that tape there. All right, so the last step is to redo the first step, to anchor those strips. Again, here, at an angle, and around. And what I like to do, I like to kind of get that in there. Now let's test this out here. This should also support your arch too. If you do have plantar fasciitis, this taping actually will help that because it'll give a little bit of arch. But if you can see what I've done here, I've made a nice cushion in my heel. I don't know if you can see that there. Allowing for that area, that irritation to heal over time, and eventually you won't have to tape it up. This taping job usually will last about a day or two. After that, you gotta, you can take a shower with it, but after that, you gotta replace it and redo the tape. But it's a simple solution. As you can see me stand here, it actually supports my arch. I'm not caving in a whole lot there. And right, yeah, it's making a nice cushion right there on my foot. You see that? Okay. So, as far as the taping goes, you want the tape snug, but you don't want it to be restrictive. Obviously, if your toes start getting numb, that type of thing is too tight, take it off, redo it. But yeah, this is a great solution. It's a great taping for plantar fasciitis. It'll help with that, but most importantly, it'll help with the fat pad syndrome or the heel pad syndrome, in which right here patients are starting to, you guys are getting pain right in the dead center of that heel. So if you have any questions or comments, please comment in the comment section below. And if you have any other conditions you may want us to talk about, go ahead and leave that comment below as well. And again, we thank you, we appreciate you watching, and we'll see you next time.